Within the polished environment of a modern salon, an invisible ecosystem operates. Past the mirrors and spotless floors, high-frequency biological exchanges swarm across combs, shears, and surfaces during every client interaction. Professional cosmetology sits at the intersection of personal care and public health. Skin-to-skin contact, the presence of organic matter like hair and sebum, and the use of warm, moist tools create a high-risk environment for microbial transmission. Under legal frameworks like Kentucky's KRS 317A, a cosmetology license serves as a government-verified attestation of competency in infection control and chemical toxicology. The integrity of the invisible clinical barrier maintained between clients defines the standard of a professional salon. When this safety perimeter collapses, it is rarely the result of a lack of formal education. Most state board violations stem from the normalization of deviance, the gradual, daily acceptance of minor operational shortcuts. This deviance most often manifests as the clean-looking fallacy. This fallacy assumes that because an implement physically appears free of debris, it is microbiologically safe to use on the next client. Trusting the naked eye fails to account for the primary threats in a salon ecosystem. Bloodborne viruses like hepatitis B, bacteria like MRSA, and resilient fungal spores remain invisible and can survive on dry surfaces for days. This matrix categorizes the 4 primary pathogenic threats: bacteria, viruses, fungi, and parasites. Note the extreme environmental persistence here. Hepatitis B survives on unsterilized surfaces for up to 7 days, and fungal spores remain naturally armored against standard detergents. These pathogens use 3 transmission mechanisms: direct skin contact, indirect contact through intermediary objects like unwashed shears, and airborne transmission through the dust and aerosols generated by electric nail filing or high-velocity blow-drying. To block these pathways, the industry employs a tool classification system. Every implement is categorized as either porous, meaning single-use, or non-porous, meaning it can be chemically disinfected. This microscopic cross-section of a porous emery board reveals why classification matters. The physical structure is filled with tiny pits and crevices that absorb fungal spores and cellular debris deep beneath the visible surface. Because liquid disinfectants cannot penetrate these deep, absorbent crevices, the scientific mandate is absolute. Items like nail files, cotton rounds, and wooden spatulas must be discarded immediately after single use. Returning a used porous item to a workstation guarantees the cross-contamination of the next client, entirely bypassing the salon's safety perimeter. For non-porous tools, the transformation from contaminated to safe relies on the 5-step full sanitation workflow. This is an unbreakable scientific chain, where failure at any step invalidates the entire cycle. Step 1 is mechanical cleaning. Scrubbing with soap and water removes sebum and hair. This organic matter forms a soil load, a chemical shield. Without scrubbing, liquid disinfectant molecules bounce off the oil layer, failing to reach the trapped bacteria. Dropping an unwashed tool into a jar of chemical disinfectant neutralizes the active ingredients in the jar, leaving both liquid and tool contaminated. Step 2 is rigorous rinsing. Residual soap from the mechanical cleaning phase reacts with chemical disinfectants, creating a barrier film that prevents total surface contact. Steps 4 and 5 involve strict drying and labeled storage. Storing a damp tool in a closed container invites metal corrosion and the growth of mold. Chemical disinfectants are useless unless preceded by rigorous mechanical friction. Chemistry cannot compensate for a lack of physical cleaning. Once scrubbed and rinsed, we reach Step 3, chemical disinfection. This requires full submerged immersion in an EPA-registered hospital-grade liquid. This countdown tracks the contact time mandate. The duration an implement must remain submerged for pathogen destruction. Viral and fungal agents require exactly 10 minutes of uninterrupted immersion. If stopped at 2 minutes, the decay graph halts. A massive microbial population survives. This same logic governs the no double dipping rule in aesthetics. Returning a used waxing spatula to a bulk container instantly compromises the entire product jar, requiring immediate disposal. Contact time is a biological law. Pulling a tool early provides zero protective value to clients. Beyond biological agents, the salon environment contains a complex array of reactive chemicals that require the same operational rigor. Nail technology utilizes the toxic trio, formaldehyde, toluene, and dibutyl phthalate, which presents severe neurological and respiratory hazards without proper local exhaust ventilation. Notice the extreme alkalinity of sodium hydroxide, the active agent in hair relaxers. At a pH of 12 to 14, it sits in stark contrast to the natural acidity of human skin. A single misapplication can cause permanent tissue damage. To manage these risks, the Hazard Communication Standard requires every facility to maintain an accessible safety data sheet, or SDS, for every product in use. The SDS provides precise first aid protocols. For a sodium hydroxide burn, the sheet dictates a continuous water irrigation of the site for 20 to 30 minutes. The SDS binder is an active survival tool for managing the toxicological realities of salon chemistry. In a regulatory environment, documentation is the only verifiable evidence of compliance. State board inspections operate on a rigid legal presumption. If an action is not recorded in a legally compliant log, the law dictates that the action never occurred. This is critical for the pedicure basin. The internal plumbing of these basins is a primary site for Mycobacterium fortuitum, a pathogen that forms resistant bacterial communities called biofilms. Dismantling these biofilms requires a multi-stage flushing and chemical circulation protocol at the end of every business day. Without a signed, time-stamped log proving the basin was flushed, the salon operates in a state of unverified liability, exposing clients to severe infections. Compliance by design prevents the normalization of deviance by making safety the path of least resistance. Here, we see a workstation engineered for compliance. Identical, labeled containers for clean and dirty tools build the muscle memory required to prevent cross-contamination. Digital integration addresses the verifiable evidence gap. By using QR codes at each station, a salon creates a time-stamped, auditable record of the 10-minute disinfection cycle, ensuring physical mandates are actually met before the next client is served. This standard establishes the beauty industry as a vital, frontline partner in the nation's public health infrastructure. In a professional setting, clinical safety must shield technical artistry to ensure that aesthetic results never come at the cost of public health.